Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today I'm going to be talking about pulmonary embolism and DVT. These are not the most difficult questions I've ever done, but there's some really good testing strategies I'm going to talk about during this lecture that may really help you when you're taking your NCLEX. So let's go ahead and get started. Hello, Clinic Review family. It's Dr. Sharon. You know that I'm a part of the Greater Clinic Review organization. This YouTube channel is offered to you at no cost because we know that not everybody can afford to pay for the full clinic review. So Mark Klimek, who's the GOAT of NCLEX prep, we have a website, clinicreviews.com. You can go there and you can sign up for his online on-demand NCLEX review. It's over 21 hours of teaching that Mark does to prepare you for NCLEX. It's phenomenal. It is different than what we do here on the channel. And then we also have small group tutoring. I did just tutoring last night. I think I had 40 people there. If you sign up for the small group tutoring, it's a monthly package. You get 4 sessions. I do 2 of them. Piece of Art, another one of our teachers, does 2 of them. And then we also have our streaming service. So let's go ahead and get started. I'm going to be teaching you about this as we go through. You know that we're primarily an NCLEX prep channel. So this isn't intended as the first time you've ever learned about pulmonary embolism or DVT. This is to teach you how to take what you already know and to apply it. Okay. All right. A nurse is teaching a patient about risk factors for developing deep vein thrombosis, which are the following are known risk factors. Select all that apply. So a DVT is when a clot forms in the deep veins. It usually is manifested by unilateral swelling. Sometimes there's redness and pain, but usually, at the very least, there's always swelling unilaterally, okay? So what puts them at risk? Immobility, smoking, use of oral contraceptives, occasional alcohol use, high HDL, or recent surgery. So these are risk factors you just should know. My guess is most of you know these. Immobility, smoking, use of oral contraceptives, and recent surgery are the primary risk factors. There are a few others, but these are the primary risk factors associated with DVT, and particularly orthopedic surgeries. It doesn't have to just be orthopedic surgery, really any surgery, but orthopedic surgeries are much higher risk than some of the other types of surgeries. Which clinical manifestations are commonly associated with a pulmonary embolism? So DVT is often a precursor to pulmonary embolism. That's why we kind of throw them in together. The abbreviation VTE, venous thromboembolism, is the umbrella term for PE and DVT. So it's a VTE, venous thromboembolism. PEs are a little more serious because they cause hypoxia, but nevertheless, PE and DVT are treated similarly. Okay, so what clinical manifestations? Dyspnea, bradycardia, chest pain, hemoptysis, hypertension, and tachypnea. You should really know these because if you are taking the NCLEX, let's say they are doing the next gen case study and it's a DVT PE case study, you don't want to choose PE, DVT unless you have clear signs and symptoms of that. So you need to know what the signs and symptoms are. So the signs and symptoms of PE are dyspnea, chest pain, and sudden onset shortness of breath. So dyspnea, shortness of breath. So it's sudden onset shortness of breath. It would be very helpful if they give you that sudden onset. Bradycardia is not one of the symptoms. It would actually be tachycardia because the body's trying to make up for the low oxygen level. So dyspnea, chest pain, hemoptysis, coughing up blood because of some of the damage in the lung resulting from that embolism. And then tachypnea. Tachypnea is increased respiratory rate. Okay, so these are classic signs. You can also see tachycardia is another one that you might see. A nurse is preparing to administer heparin to a patient with a new diagnosis of DVT. Which intervention should the nurse implement? Select all that apply. Insert a second large bore IV catheter, administer the medication via IM injection, assess for signs of bleeding, keep protamine sulfate available, encourage the patient to increase green leafy vegetables, and monitor for signs of heparin-induced thrombocytopenia. So this question actually covers a couple different things as it relates to heparin. So heparin is a anticoagulant. It prevents the blood from clotting, and so they are at increased risk for bleeding. So we want to look for interventions that we know that they're an increased risk for bleeding. But then we also want to show that we know how to safely administer the medication. Okay, so we know they're at increased risk for bleeding, and we know how to safely administer this medication. So would it be appropriate for someone who's at risk for bleeding to insert a second large bore IV catheter? That's actually contraindicated in a patient who is at increased risk for bleeding. So don't go, well, maybe we need it. I mean, they have a DVT and maybe we should do that. No, 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 no. That's not how you look at this. You say, is there any reason I should not insert a second large bore IV catheter? And the answer is yes. The fact that they're on heparin and they're likely to bleed around it is a reason. So we're not going to do that. Administer the medication via IM injection. Well, how is heparin administered? It doesn't tell us that in the question. So there's really two ways heparin can be administered. It's either sub-Q or IV. It is never given IM. So we're not picking A or B. When administering heparin, I'd want to assess for bleeding. That's pretty obvious. Yeah, that's definitely assess for signs of bleeding. When administering heparin, I'd want to keep protamine sulfate available. If you don't know this, protamine sulfate is the antidote for heparin. Okay, it's the antidote. Now, heparin has a short half-life, so we don't have to give protamine sulfate very often. But in case we do, protamine sulfate is the antidote. For someone who's on heparin, we'd want to encourage the patient to increase green leafy vegetables. Well, green leafy vegetables are high in vitamin K, which is, you have to eat a consistent diet of green leafy vegetables when someone is taking warfarin. It's not specific to heparin, but if you increase vitamin K, I mean, that's not going to help prevent clots, right? In fact, it may promote clotting just by giving increased vitamin K. There's no reason to do that. I mean, we don't want clots to form. We're trying to prevent clots from forming. So giving green leafy vegetables is not a good option. So I don't like that one. When administering heparin, we'd want to watch for heparin-induced thrombocytopenia. So that is an actual thing. Heparin-induced thrombocytopenia is low platelets. They can have a drop in platelets, and usually we're concerned about it if it drops lower than 90,000. So I realize that normal platelet range is 150 to 400, but we usually don't worry too much about it until it's under 90,000. So heparin-induced thrombocytopenia, if they're taking heparin and their platelets drop, then I would need to be concerned about that, okay? A patient with a history of pulmonary embolism is prescribed long-term anticoagulation therapy. What should the nurse educate the patient to avoid? All right, contact sports, herbal supplements, sudden changes in dietary vitamin K intake, standing for long periods, wearing compression stockings, or drinking large amounts of grapefruit juice. Okay, this is related to anticoagulation therapy. So a patient is taking anticoagulation therapy, I would teach them to avoid contact sports. Well, if they're taking anticoagulation therapy, I don't know what they're taking. Could be Lovenox, could be heparin, could be warfarin, could be something else. If they're engaged in contact sports, they could bleed and bruise. So I would want them to avoid contact sports. For a patient taking long-term anticoagulation therapy, I'd want them to avoid herbal supplements. So I just want to teach you, this is an NCLEX specific statement. NCLEX does not like herbal supplements, and it's not because they're necessarily bad. It's because there's no evidence on them for them. And NCLEX is only going to make recommendations for evidence-based interventions. So they don't like herbal supplements. So even if I don't know what ginkgo and garlic do, I am going to tell them to avoid herbal supplements on the NCLEX. Okay, on the NCLEX, I'm going to tell them to avoid that. Now, you may go, well, I know that ginkgo can promote clotting. Okay, well, fine. You can know that, but I'm just telling you on the NCLEX, if you have the option to teach your patient to avoid herbal supplements, I would pick that. If there's an option that says encourage them to take herbal supplements, I would not pick that. That's just not a good NCLEX answer. So I'm going to teach them to avoid contact sports and herbal supplements. For a patient on long-term anticoagulation therapy, I teach them to avoid sudden changes in dietary vitamin K intake. Yes, that's true, because vitamin K promotes clotting. For a patient taking long-term anticoagulation therapy, I would tell them to avoid standing for long periods of time. So this one's a little bit more difficult, but if we're going to answer the question that's being asked, and the question that's being asked is about anticoagulation therapy, specific to anticoagulation therapy, they don't have to avoid standing for long periods of time. There's nothing about standing that is contraindicated when you're on anticoagulation therapy. You might go, well, they have a history of PE. But this question is specifically talking about education related to anticoagulation therapy. So I'm not going to pick D. For a patient taking long-term anticoagulation therapy, I would tell them to avoid wearing compression stockings. There's no reason to avoid wearing compression stockings when they're on long-term anticoagulation therapy. In fact, I wouldn't be opposed to them wearing compression stockings. Certainly, there's no reason to avoid it. For a patient on long-term anticoagulation therapy, I would teach them to avoid drinking large amounts of grapefruit juice. Okay, this is where it's good to read the whole answer. Lately, I've been reading answers halfway, like in my own when I'm going through questions. Lately, I've been just reading half the answer and getting it wrong because I read half the answer. Y'all don't read half the answer. Because I thought it was going to say drink large amounts of fluid, avoid drinking large amounts of fluid. I'm like, no, I'm not going to teach them to avoid drinking large amounts of fluid, but I am going to teach them to avoid drinking large amounts of grapefruit juice. Never have them drink grapefruit juice if they're on any prescription meds. It's like contraindicated with almost every prescription med out there. It messes with how it works. So yes, I'm going to teach them to avoid drinking large amounts of grapefruit juice. And the reason I find it helpful to repeat what the question is asking for every answer is so I don't forget what the question is asking. The question is asking what to avoid. And if I don't repeat it with every answer and make sure I read the entire answer, I'm going to mess up. So I know that it takes a little more time to turn this into a series of true-false statements and associating it back to the question. I know it takes a little more time to do that. But you are much, much, much more likely to get these questions correct if you do that. A nurse is educating a patient recovering from a pulmonary embolism on lifestyle modifications. Okay, we're talking about lifestyle modifications. Which recommendations should the nurse include? Increase hydration, avoid prolonged sitting or standing, cross legs when sitting, avoid aerobic exercise, maintain a healthy weight, avoid compression stockings. Okay. Nurse is educating a patient recovering from PE on lifestyle modifications. Which recommendations? Okay. Recommendations post-PE, increase hydration. Yes, actually, that's a good idea. You want to stay you always want to stay hydrated. Okay. Of course, I want to stay hydrated. So for a patient recovering from PE, I tell them to avoid prolonged sitting or standing. So that's actually true. Prolonged sitting or standing is specific to the PE. It's not specific to the anticoagulation therapy. That's why I put these questions right next to each other so you could see how you have to answer the question that's being asked. So for post-PE, I would teach them to avoid prolonged sitting or standing. That's true. Post-PE, I would teach them to cross their legs when sitting. No, they don't want to cross their legs. So I want to teach them to avoid crossing their legs when sitting. So I'm not going to recommend they cross their legs when sitting. So that's false. For a patient post-PE, I would teach them to avoid aerobic exercise. No, there's no reason to avoid aerobic exercise. No reason for that. In fact, it's good. Gets the blood pumping and all that. For a patient post-PE, I would teach them to maintain a healthy weight. Yes, that's always a good recommendation. For a patient post-PE, I would tell them to avoid compression stockings. That's actually false. They can wear compression stockings. It helps avoid blood stasis so that they don't get a DVT, which can turn into a PE, right? That's all good. So these are the correct answers. And again, these are not answers that like just jump out at me because the questions are worded a little bit in a little bit complicated way. So what I'm teaching you is when you're answering, select all that apply questions. This is really a teaching you how to answer, select all that apply questions as it relates to PE and DVT. But what I'm teaching you is that you take every answer and you relate it back to the question and turn it into a true false, and then say, am I picking the true or am I picking the false statement? And then that's how I answer them. By the way, you need to expect a minimum of 40 SATA questions, a minimum of 40 SATA questions. So you have to be just as comfortable with SATA questions as you are with single choice answer questions. And there are many times where I actually, even with single choice questions, I turn them into a series of true false statements. Even though I'm only picking one of them, I still turn them into a series of true false statements so I don't forget what the question is asking me. A patient on heparin therapy for DVT develops a platelet count of 90,000. Okay, so that's low. What is the nurse's best action? Thrombocytopenia. So a patient on heparin therapy who develops thrombocytopenia should continue heparin and recheck platelets in 24 hours. That seems not the best option because you have heparin-induced thrombocytopenia. With a patient who's started on heparin and has thrombocytopenia, I should stop the heparin and notify the provider. That seems like a good option. We'll see what else there is. For a patient who started on heparin therapy and has thrombocytopenia, I would want to administer phytonadione. So if you don't know this, phytonadione is the word NCLEX is going to use for vitamin K. And vitamin K does not reverse heparin. You would want to give protamine sulfate. It reverses heparin. So phytonadione is not the appropriate intervention here. For a patient started on heparin therapy with thrombocytopenia, I would want to encourage fluid intake to prevent clot formation. That's not really the risk, actually. They're at higher risk for bleeding, not higher risk for clotting. So the only option that makes sense here is to stop the heparin and notify the provider. So I told you that we're not really worried about platelet count until it's under 90,000. And you might go, well, it's not under 90,000. Well, I'm okay stopping the heparin and calling the provider when it's at 90,000. Like I'm okay with doing that. It's that 90,000 mark. If it was like 110,000, I would probably continue the heparin and recheck it in 24 hours. But at 90,000, I'm going to go ahead and stop it, notify the provider. A nurse is reviewing the medication orders for a patient with a new diagnosis of DVT. Which medication is most likely to be prescribed for immediate anticoagulation? So warfarin results in immediate anticoagulation. That's false. Heparin results in immediate anticoagulation. That's true. Aspirin results in immediate anticoagulation. That's false. Aspirin is an antiplatelet. Clopidogrel, which is Plavix, results in immediate anticoagulation. That's also false. So heparin is the only one that results in immediate anticoagulation. Which patient is at the highest risk for developing a DVT? Highest risk: a 35-year-old female on oral contraceptives who smokes, a 50-year-old male who drinks 5 beers a day, a 42-year-old female who had a recent hysterectomy, a 29-year-old male with a history of migraines. So whenever I get a highest risk question, this is pretty fundamental, but I want to make sure that you know how to answer this. Whenever you get highest risk, you count the number of risk factors and you choose the patient who has the most risk factors. So let's see who has risk factors. So age and gender don't influence risk factors with DVT. Okay, so age and gender don't matter. All right, so a client who has oral contraceptives, that's a risk, and smokes, that's also a risk. So A has 2 risk factors. B, who drinks 5 beers a day. Alcohol intake actually is not a risk for DVT, so I'm going to cross that off the list. A client who had a recent hysterectomy, she had recent surgery, so that's 1 risk factor, so she's on my list. Client who has a history of migraines, that's not a risk factor for DVT. So it's either A or C. A has 2 risk factors, C has 1 risk factor, so I'm going to have to pick A. A nurse is assessing a patient with a suspected pulmonary embolism. Which diagnostic test is most definitive for confirming PE? Chest x-ray, D-dimer, VQ scan, or pulmonary angiography. So chest x-ray is out. D-dimer tells you if there's clotting going on somewhere in the body, like an elevated D-dimer tells you there's clotting going on in the body, but it doesn't tell you where, so it's not definitive for a PE. Ventilation perfusion scan does determine if they have a PE, but the gold standard for PE diagnosis is pulmonary angiography. That's just something you have to know. A nurse is providing discharge teaching to a patient who has been prescribed Lovenox, enoxaparin, for DVT prophylaxis. Which statement by the patient indicates a need for further teaching? Further teaching. I should avoid taking aspirin or NSAIDs while on this medication. I need to have my INR checked regularly. I will inject this medication in my abdomen, or I will monitor for any signs of bleeding or bruising. So I'm looking for further teaching. That means false. It means I'm looking for the false teaching. Okay. So, discharge teaching. I should avoid taking aspirin or NSAIDs while on this medication. That's actually a true statement. Aspirin and NSAIDs are antiplatelets. You don't really want to take it without being told to, unless the provider tells you to. You want to avoid anything that's going to increase bleeding time. So they would definitely want to avoid. So A is a true statement. I need to have my INR checked regularly for Lovenox. That's not true. Lovenox is not INR. INR is Coumadin, warfarin. So B is a false statement. I will inject this medication in my abdomen. Lovenox will be injected into the abdomen. That's true. That's where you inject Lovenox. When on Lovenox, I will monitor for any signs of bleeding or bruising. That's also a true statement. And I'm looking for the false statement. So B is the correct answer. And remember, pay attention if they're asking for an indication that they learned what you taught them or an indication they need further teaching. Okay, so I always say I always love it when they use the word further teaching, because further teaching always means false to me. And that's like a red flag word. And I go, okay, that's an important word right there. I got to pay attention to that. All right. Well, that is it. I would not say that's a total comprehensive DVT and PE, but I was teaching you some really important strategies for SATA questions. I taught you a couple of things. Don't forget what I said about herbal remedies and so forth. So I hope that was helpful to you, and you have a great rest of your day. Take care.